Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Clarithromycin. Its brand name is Biaxin. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video, as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how clarithromycin works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe clarithromycin. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. So how does clarithromycin work? Well, it binds to the 50S ribosomal subunit of the 70S ribosome of susceptible organisms. It inhibits bacterial RNA-dependent protein synthesis. Now, in terms of indications or reasons we would prescribe this medication to a patient, we may see it used in H. pylori gastrointestinal tract infections. We may see it used to treat community-acquired pneumonia or streptococcal pharyngitis. Clarithromycin may be used to treat acute otitis media. We may see it used in the affection of the skin, or subcutaneous tissue, and there's also some other indications as well. Now, with respect to contraindications or reasons we would not be able to prescribe clarithromycin, we wouldn't be able to give it to a patient who had a hypersensitivity to clarithromycin, erythromycin, other macrolides, or any other component of the formulation. Also, patients with a history of liver dysfunction with prior use of clarithromycin would not be able to use the medication. As well, it's not to be used with colchicine in patients who have kidney or liver impairment. Now, what about dosing with clarithromycin? So, if it's used to treat an infection of the skin or subcutaneous tissue, and it's the immediate release formulation, we may see 250 milligrams orally twice daily for 7 to 14 days. In the treatment of community-acquired pneumonia for the immediate release formulation, it would again be 250 milligrams orally twice daily for 7 to 14 days. And if a patient was using the extended release formulation, they may use 1,000 milligrams orally once daily for 7 days. Now, as with all medication, there are some side effects or adverse reactions that patients may experience while using clarithromycin or Biaxin, so we'll go over some of those here now. 2 to 9% of patients may experience diarrhea, while abdominal pain may happen 1 to 8% of the time. 8 to 19% of patients may experience a disorder of taste, and 4% may experience indigestion. Nausea may happen 3 to 28% of the time, and vomiting 1 to 25% of the time. Up to 9% of patients may experience a headache. Now, some more rare but serious side effects would be Clostridium difficile associated diarrhea, liver failure, or a prolonged QT interval. That's all we're going to talk about today with clarithromycin or Biaxin. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.